Hello everyone, I am Dr. Anu and in today's video I am going to cover cranial nerve testing or assessment, which forms a core part of neurological assessment. As we know, there are 12 cranial nerves. The first cranial nerve is olfactory nerve, and olfactory nerve is responsible for the smell. So the testing is done by checking the smelling capacity of the patient, and the test is very simple. You can give a small coffee or a soap, a small bar of soap to the patient to smell, and if the patient is able to appreciate the smell, olfactory nerve is all correct. So this is simple. It is a sensory nerve. There is no motor supply associated with this nerve. This completes the testing of our first cranial nerve, which is olfactory nerve. The second cranial nerve is optic nerve, and optic nerve has two roles. One is visual acuity and other is visual field. So for the visual acuity or accuracy, we will refer to the Snellen chart testing. And as a physiotherapist, you may not be appropriate professional to do the Snellen chart testing in ICU setting. So visual field testing is more appropriate to conduct the cranial nerve testing of optic nerve. For that, what will you do? You will bring your two fingers sideways like this. You will keep it in your peripheral field, like you take them apart till the time you are able to see. Now I am able to see them at this point. Now you will keep it in your fingers in front of the patient and will ask, are you able to appreciate it? You will take it away and you will ask for the feedback of patient, are you still able to see it? Then you will again bring them closer and ask and notice with the patient when the patient is able to see them in his optic field. If it is in congruence with your optic field, it is normal. If it's not, there is a deficit of optic nerve. You can also check for the, as I said, accuracy of vision by Snellen chart. The lowest alphabets has to be read by the patient, but then there could be some generic vision defects. If the patient is already using specs, there would be of course consideration which you need to keep in mind. Well, the third cranial nerve is oculomotor nerve. Now third, fourth and sixth, these three cranial nerves supply the eye muscles, right? So we ask the patient to look into the H figure, right? Like you will draw H and you will ask patient to trace your hand. Idea is that, see, now let me just brief it properly. There are 6 eye muscles: lateral rectus, obliques, which are like obliques superior and inferior obliques, and then inferior rectus and superior rectus, right? And of course medial side, like if I am seeing this ways, the medial muscle of my left eye and the lateral rectus of my right eye is functioning. So if you are looking upwards and outwards, it is the superior oblique muscle of one eye and the inferior rectus muscle of the other eye, which is creating that equal vision for the both eyes. So checking the patient's field while you're drawing H, like he is going down, then he is going horizontally, then he is looking upwards, and then you're bringing it downwards without really bending his neck. This will give you clarity about which muscle deficit is there, and accordingly you can pick up the optic nerve. You can pick up the cranial nerve where the deficit is there. Fifth nerve is trigeminal nerve, and trigeminal nerve has both components, sensory as well as motor. Now trigeminal nerve supplies the face, like not like facial nerve. I'll discuss that in the coming moments, but trigeminal nerve supplies the sensory part of the face, towards the eye, towards the cheek and the lateral side of the jaw. So you will check for the sensation, with light touch sensation, pinprick sensation on the affected side of the face, and if there is a deficit, it indicates trigeminal nerve involvement. Sometimes trigeminal neuralgia can be present and the patient will give you a typical pain pattern in this segment. So because the sensory nerve is irritated, that creates tenderness or pain around the sensory supply of facial segments. And motor supply, if I talk about, Trigeminal nerve is supplying the masseter muscle. So while testing, you have to check for two deficits. One, the patient will have sensory deficit around the face, and second, there will be difficulty in chewing the food, because masseter muscle is responsible for the chewing action. So if the patient is unable to chew food, especially from one side, it's quite obvious that trigeminal nerve is involved. We discussed sixth nerve, which is abducens nerves already, that controls the lateral rectus muscle of both the eyes. So you ask the patient to look laterally, and if that is affected, it indicates that sixth nerve, cranial nerve, is affected. Now seventh cranial nerve is every physio's favorite, facial nerve. Facial nerve supplies the sensory part of the face also, and it also supplies the muscles. So to test the facial nerve, you will check for the different actions of different facial muscles, like you will ask the patient to close the eyes tightly, raise the eyebrows, smile, fill air in the mouth, show teeth. So these various functions will give you a clarity. If there is asymmetry in the face, facial nerve of that particular side where the weakness is obvious is affected. Coming to the eighth cranial nerve. Eighth cranial nerve is auditory nerve, responsible for hearing. Now auditory nerve testing is done using a tuning fork, though there are two tests for it. One is Weber test and another is Rennie's test. Now what we do in this, we take a tuning fork, we kind of like tap it, vibrate it on a hand, and place the tuning fork on the center of the head or on the vertex. Now what happens, that vibration will travel to both the ears through the bony connect of skull. Now in a normal case scenario, patient would be able to hear it equally in both the ears. But in pathological cases, the sound would appear louder in the affected side, and it would apparently sound lower in the normal side. So that gives you a clarity about impact of auditory nerve. Coming to the next nerve, which is glossopharyngeal nerve, ninth nerve. 10th nerve is vagus nerve and 9th nerve is glossopharyngeal nerve. Now these both nerves have almost similar functions. The glossopharyngeal supplies the tongue, and vagus nerve is an autonomic nerve supplying various organs like heart and gut also, but function wise if I talk about, it is responsible for voice and swallowing. So you have to check the gag reflex for the patient. And how do you check gag reflex? You can take a small ice cream stick and press the tongue if the patient, and try to touch the posterior side of the face. If there is gag reflex coming up, it is normal. If it is absent, it is diminished. There could be pathology of 9th and 10th cranial nerve. You can also check for the voice of the patient. There is hoarseness of the voice. Again, it indicates towards some involvement of glossopharyngeal or vagus nerve. You check for the asymmetry on both the sides when the patient is doing gag reflex. That is also one of the indications. 11th cranial nerve is spinal accessory nerve. Spinal accessory nerve supplies two muscles, trapezius and sternocleidomastoid. So you check for the function of trapezius, ask the patient to elevate their shoulders, give resistance, check for it, ask the patient to turn the neck to one side and resist the side flexion of the neck, rotation of the neck, sorry. If the patient is unable to hold the resistance, definitely spinal accessory nerve is involved. The last cranial nerve or the 12th cranial nerve is hypoglossal nerve, and hypoglossal nerve supplies the tongue. So the taste of the different like sweet, sour on the anterior 2/3 of the tongue, and check for the fasciculations or if there is any atrophy of the tongue. So ask the patient to protrude the tongue out and look for the signs of fasciculations or atrophy or deviation. If the tongue is deviating to one side, that indicates towards the cranial nerve deficit of 12th cranial nerve or hypoglossal nerve. So this was all about cranial nerve testing. I hope you found it very simple and easy to learn. I have tried to talk to you in a way that we are revising some notes for the final preparation before exam or before a clinical assessment. I hope you liked it. For more topics, please engage with us on comments. Mention what all topics you want to get covered. We'll meet you in the next video. Till then, please like and subscribe our channel. Thank you so much.